Alcohol, as probably a number of you know, is probably the most single toxic drug out there. It kills brain cells, it kills liver cells, it can cause liver failure and death, in higher doses for a long enough time. And so we have some special approaches here, and we have a lot of training in working with alcohol withdrawal because it can be quite significant. Sometimes people get what they call delirium tremens, or popularly known as DTs, where people kind of hallucinate when they come off alcohol, and other people can actually have seizures coming off of alcohol. So we use specific medications that have been tested in state-of-the-art systems like gabapentin and trileptal, for example, are brain calming medicines, anti-seizure medicines that can help get people off the alcohol without dangerous withdrawal. And then we use the nutritional supplements that we have to repair the brain chemistry. We use the detox system that we have to get all of the toxins that have accumulated with toxic drugs like alcohol. And also, like all the other drugs of abuse, we also really need to use therapy to help people see why were they drinking in the first place. If they can get that handled, and we have very skilled therapists here that have a lot of specific training in alcohol and drug abuse, we can help them deal with it so that they don't go back out and relapse on alcohol.